You're not trying to keep the workers from getting infected because you love the workers. We know in the Trump administration that's not your strong suit. You don't have to love the workers. If you just want to keep the meat supply unbroken in this country, you have to keep people who work at meat processing plants alive and at the job, which you can only do if you change the way the plants work. Why don't you get this? But this is our government right now, and they apparently cannot handle concepts even this simple. So we've got from our government, right? I mean, top of my head, right? The disastrous meat plan executive order, which is putting our meat supply more at risk than anything else the federal government has done in this crisis. There's also the FDA decision in the Trump administration to willy-nilly allow anything calling itself a coronavirus antibody test onto the market without any sort of quality control or testing of those tests at all. The FDA has been doing that for weeks. They're only now getting around to telling the hundreds of entities that have put these mostly dodgy tests straight onto the market that actually now, after the fact, now they're going to need to show some data that indicates those tests might work. Oh, good job, Trump administration. In a Friday night news dump late at night, Friday night, the president got rid of the Health and Human Services Inspector General, the one who reported that hospitals were having a hard time getting necessary supplies, including both tests and PPE to protect their staff. Undoubtedly true, helpful report from the Inspector General, so naturally she's got to go. Today, the Washington Post reports on a whistleblower who has come forward to the House Oversight Committee to tell them all about the Boy Genius volunteer team that presidential son-in-law Jared Kushner put together to be in charge of getting necessary PPE to American hospitals. Well, that team, under Jared's leadership, was excellent, it turns out, at things like expediting requests and paying special attention to tips and questions from conservative TV hosts. But they were not so good at actually getting PPE to health workers in American hospitals. Maybe because, oh my God, this is how the U.S. federal government decided we would tackle this challenge. Quote, the document alleges that the team responsible for PPE had little success in helping the government secure such equipment, in part because none of the team members had significant experience in healthcare or procurement or supply chain operations. In addition, none of Jared's volunteers had relationships with manufacturers or a clear understanding of customs requirements or FDA rules, according both to the complaint and to two senior administration officials who corroborate. So that whistleblower complaint, per the Post's reporting, is supported by corroboration from multiple administration officials. Yeah, they're making lots of good decisions up top these days. Today, we learned they're going to disband the coronavirus task force. Since, all better now, let's reopen, everything's fine. They're still, in the Trump administration, as of right now, fighting to take away health insurance from millions of Americans by killing the Affordable Care Act with a Supreme Court case. Seems like an excellent time to take health insurance away from millions of Americans. The part of the Trump administration that oversees nursing homes and long-term care facilities. Right now, what are they working on? They're loosening the rules about what nursing homes need to do when it comes to infection control. Right now, that's what they're working on. They're saying nursing homes should be way more lax when it comes to infection control inside those facilities. Sure, why not? We've learned that the official the president put in charge of public health preparedness and things like building up the national stockpile of stuff we would need in a pandemic. He halted an Obama-era initiative to spend $35 million to build a machine that could produce 1.5 million N95 masks per day. Wouldn't that have been great if the U.S. government had that? For $35 million, you could have had 1.5 million masks every day, 7 days a week. No, he killed that. So he instead could spend freely on smallpox vaccine supplies from a company he used to work for that appear to have been severely marked up.